Cardiopulmonary resuscitation, also known as CPR, is a technique used to pump blood throughout the body. This is done on a patient when the patient goes into cardiac arrest. Cardiac arrest is when the heart stops beating. When this happens, oxygenated blood stops running throughout the body. This causes problems because if you don't have oxygen running through your body, your organs can't function. CPR is a technique that saves thousands of lives each year. Only 56% of the population in the U.S. knows how to administer CPR. According to the CPR administration, if more of the population knew how to administer CPR, thousands and thousands of lives would be saved. Therefore, I would like to demonstrate to you how to administer CPR, including the techniques, the changes over the years, and the differences between pediatric, child, and adult. So, starting with the techniques. This is Bob. Bob's our CPR dummy. Starting with the technique. When you want to administer CPR, you start by placing the heel of your right hand on his sternum. The sternum is the chest bone. Below the sternum is a small triangular bone called the sigmoid process. If you place your hand too far down, you can push down on the sigmoid process, which would then puncture the lung. That would be wrong because then the patient wouldn't be getting air or breaths. So, starting with the heel of your hand, you place it about 4 inches down from the throat. So you place that hand, and then with your left hand, you overlap your fingers. You must lift the fingers of your right hand up, because if you place them down, then you could be pushing down on the ribs, which would also puncture the lungs. So, starting with the hand here, you cover it and you push down once. You must push down about 2 inches so that you will actually be pumping the heart. When you're administering CPR, you are manually pushing the heart. When you do this, the blood in the heart pumps and it spreads throughout the body. When you pull up, then the blood fills back in. So you're pumping the oxygenated blood throughout the body. So the CPR administration recommends that you give 30 compressions per 2 breaths. So I will show you one set of CPR. And I will also count how many compressions I am doing. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. After we administer the first 30 compressions, we have to give breaths. Before we start off with this, we have to check if the airway is clear. So first we check for breathing, which we just go and place our ear very close to his mouth, tilting his head back and listening. If we don't hear breaths, the next step is we open his mouth and do a sweep. So we tilt back and we just put our finger through his mouth and pull anything out of there. So then we have to go and administer breaths. There are 2 products we can use. The first thing is a CPR pocket resuscitator. So we'll just open this up and push out the pump. We then place the pump around his nose and it creates a seal. If you don't create the seal, all the breaths that you are giving pumps right back out through the nose, and then the breaths are not going through the lungs. So I'll show you how to do one breath. 1,000, 2, 1,000, 3, 1,000, 4, 1,000. The CPR guidelines for the breath is you have to count 5 seconds between each breath. So when I gave the first breath, I counted 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000. After that, I give the second breath. Another device we can use for giving the breath is the breathing barrier. This is just a plastic sheet with a white breathable material in the middle. So we just go and we place the breathable material on his mouth, stick it a little into his mouth, and close the nose. With this resuscitation device, it covered the nose completely, so that when you gave the breath, the air didn't go back out. With this, you have to manually close the nose so the air doesn't go through the nose. You then tilt his head back and give a breath. While you give the breath, you have to make sure that his chest is rising. If it doesn't rise, that means there's something in his airway that is blocking it. So then you have to try and pull out the object. Next, the changes over the years. The CPR administration changes the guidelines for CPR about every 2 to 4 years. Previously, they had called for 15 compressions to 2 breaths. With that, you're getting more oxygen per compression. which changes. And lastly, the difference between adult, child, and infant. As I said earlier, for an adult, you have to do 30 compressions per 2 breaths. With a child, it changes to 15 compressions and 2 breaths. And last, with an infant, it changes completely. Instead of placing one entire hand on his chest, you place just 2 fingers. These 2 fingers are placed because his body is fragile, and if you place a whole hand on his chest, you could break the sternum and all the ribs. So with a child, you would just go place 2 fingers and push down lightly, and then you do 15 compressions per 1 breath. So therefore, CPR is a life-saving device. I hope that I have shown you how to do CPR and that you may now go and save other lives. Thank you.